Hello everyone, my name is John Mott, stroke survivor, stroke mentor, author of Grace Down Below, and also owner of Forerunners Incorporated. Today I want to talk about specifics of stroke. And what are they? Well, if you know, or even if you don't know, now you'll know. I want to share with you the two major stroke types for what they are. There's two different strokes that you should be aware of. There's a hemorrhagical stroke or brain hemorrhage, or even there's ischemic stroke. And the difference is this: a hemorrhagic stroke is when you have massive bleeding in the brain and your artery is ruptured, affecting one side of your brain. The other type of stroke is an ischemic stroke. That's a clotted artery wherein the blood flow is interrupted with some type of blockage within the artery. So, being that there's two different types of strokes, there's one thing you need to know: that the most common type of stroke is an ischemic stroke, which accounts for, as on average, I would say 85%, 85 to 87%. So that's the most common type of stroke. The least common is a hemorrhagic stroke, the type of stroke I had, which is a ruptured artery in the brain, which disperses blood all over the brain cells, and on average it kills millions of brain cells by the minute. So with the two different type of strokes, knowing what you know now, you can now make a more informed decision as far as moving with urgency, because you could actually save a life. And believe it or not, the least common type of stroke accounts for majority of deaths, which is at least on average 30% of deaths of all stroke victims. For those who survive, stroke survivors, as myself, we're very fortunate and we're very blessed, because there's a lot of different factors in stroke and stroke recovery, and going through therapy, and psychological, it's mental, it's emotional, even spiritual, as far as the outcome and the recovery process. There's many things to consider when you're talking about stroke. I just mentioned the two different types. One last thing I would like to share with you is the fact that majority of these are preventable. Matter of fact, 2009, when I had the stroke, 520,000 of those strokes were preventable out of 750,000. So think about that. The numbers went up to 795,000 annually for a stroke. So that means that even more numbers are preventable. So once again, this is John Mott, stroke survivor, stroke mentor, author of Grace Down Below, and owner of Forerunners Incorporated. And I want you to keep that in mind, that there's two major stroke types. Take care. God bless.